Drilling surgery phase. The drilling process is a fundamental phase in implant implementation. There are many important factors to be considered when drilling properly. Such factors as drilling speed, drill type, torque, refrigeration, intermittence, etc. will help us obtain a successful implant. Inadequate temperature control during drilling or excessive pressure would cause a weaving osseous fracture and undesirable osseous reabsorption. The Treenon system should be followed by its design. Simple drilling sequence, implants, and according to the type of bone involved. Remember the 4 types of bone and the quality of osseous and their anatomic order in the jawbone. Class 1, a bone consisting of almost exclusively homogeneous compact bone. Class 2, a thick compact bone surrounded by dense spongy bone. Class 3, a thin cortical surrounded by dense spongy bone. Class 4, a thin cortical surrounded by slightly dense bone. The Q implant coil design is different from traditional implant systems in that it helps achieve a reduced number of drillings continuing. We can see a comparative scheme between the Treenon system and traditional systems. The great simplicity of the Q implant drilling systems gives us 3 great advantages. Reduction in surgical time. Minimum osseous reabsorption. Post-operation is untraumatic for the patient. The drills of the Treenon system are conical and their diameter coincides with the base of the implant. The Treenon Q implant system, faithful to its initial simplicity, has a reduced number of drills that we can visualize here. Based on the following outline, we can show a continuation and the sequence for drilling in all cases, which begin with a lance drill for marking, a 1.7mm pilot drill, and a 2.6mm drill. If you decide on an implant of 3.5mm diameter, Q1 or Q3, you only need the corresponding drills in a common sequence. If you decide to insert a 3.75 diameter implant with a Q2 external hexagon, a golden 2.8mm drill should be added to the specific implant mentioned before. Instead of inserting a 4mm diameter implant, an internal octagon QK connection, a blue 3.1mm drill can be substituted. If you decide to insert a 4.5mm diameter implant, Q1, Q3 or Q2, after the common sequence, a 3.6mm drill can be used. We can also use other intermediate drills if required. To gain the best stability that characterizes the Q implant system and have the maximum benefit from the condensing and expanding properties of its coils, there are 2 things to keep in mind when drilling. In bones of lower osseous quality, spongy or type 4, we should avoid the last drill in the sequence we have stated. In bones of high osseous density or type 1, it's advised to follow the drilling protocol indicated, and use the largest diameter drill as the last drill specified in the implant to avoid excessive tension.